Ma'am, we can start now. Ma'am, we are live. Huh?
Just talking in between.
Very good afternoon, sir.
Ji, namaskar, ma'am.
Namaskar, sir. So we are live. We can start the session on heat stroke.
Okay. So, ma'am, you will like me to talk in Hindi, English, both combined?
Yes, both combined on that will work.
Okay.
Thank you so
Ji,
much.
so, good afternoon, everybody, and many thanks for sparing time and joining for the session today. I think you are all aware of the extreme heat wave that we are facing this time. And I remember 44, 46, 48 would be the highest that we would experience. This time it has already touched 52.3, which is too inhuman, and it is certainly creating lots and lots of issues for the public at large, and of course for some specific age group of patients who have more issues because of their body not being so strong. So, how to deal with this? And then what is the different pattern of diseases and symptoms and complaints that this heat may be causing. Heat stroke is of course one extreme form of it, but understand that before the patient faces heat stroke, there are a lot of other complications or problems which he might have faced, and therefore correcting them at the right stage is more important. So why wait for heat stroke when the simple precautions at the very early stage are going to be more beneficial for all the patients who are going to be a part of it. Okay, so take it that way. But since all the discussion, which is close to 20-25 minutes, will be on high temperature, I do want to mention that even extreme of low temperature is going to be a big cause of concern. So उसको हम लोग hypothermia बोलते हैं. Hypo is on a lower scale, where the temperature of the body and the surroundings is lower than normal. So hypothermia or systemic cold injury occurs when the core body temperature has decreased to 35 degree or 95 degree or lesser. They are either primary or accidental, occurs in individuals who have inadequate clothes and exposed to severe cooling. And secondaries are where there are some hemodynamic and functional abnormalities that have happened in the body. Now, when we talk about heat illness, so we started the heat stroke. But if you see here, heat stroke is stage 4 of the problem. Let us not forget heat rash, heat cramps, fainting, heat exhaustion, and heat stroke. These are other terminologies that we use, and step by step we are going towards higher and higher platform with more complications, more risks, and more longer care required for association. If you have been working in the fields, let's say you are into some kind of sales or related and you move out, by the time you reach home, even if you have an air conditioned car, you are thoroughly exhausted. So heat exhaustion is that what we use as, and it is probably the commonest form that we all experience to various degrees, and therefore on the same strength, many of us chakkar aa rahe hain, fainting ho rahi hai, mujhe letne do, we'll talk later. All those things which we all have been experiencing. Heat cramps are milder forms where there are severe pains happening in the muscles. So skin changes because skin first of all faces the heat. So from skin change to muscle change to fainting to heat exhaustion and heat stroke. This is the way the things go. What is heat cramp? Heat cramp is basically muscle pain. Look at the area which this gentleman is holding. This is holding the calf muscle, जिसे पिंडलियां बोलते हैं. Because this is the muscle while we walk, while we do exertion, this has to move so as to move the whole body directly or indirectly. So this will automatically show the effect of any negative effect much sooner than other areas. If I am walking, legs are in use, arms are much less in use. Look at the heat rash. And in a varied form for people who are chronically exposed to high heat, this and therefore the sun, this leads to tanning, darker skins of the individual. So जो आप लेबर क्लास लोग फील्ड्स में रोड साइड पे काम करते हुए देख रहे हैं, वो नॉर्मली हमारे से बहुत ज्यादा डार्क स्किन के होते हैं, which has again been because of long exposure to the sun. और इसके अपनी एक लिमिटेशंस होनी शुरू हो जाती है, जबकि कुछ और ऐसे एरियाज हैं जहां पे ऑफिस में से 2-2 घंटे तक लोगों को बोला जाता है कि आप ऑफिस बंद करिए और बाहर हीट में जाके आइए. सो दैट मीन्स heat exposure or sun exposure to the body, therefore to build up some essential component through the skin as is vitamin D. They are also being carried out. Heat edema is again for 2-3 things, which includes basically the effect of gravity on the overheated, over infused skin. And then of course syncope is where the person has experienced dehydration, and therefore the circulation is hampered in a way that if your blood volume which circulates is 5 liters, in such cases it might be only 3 liters which is circulating. Therefore less of it reaches the brain, and therefore the blood supply, oxygen supply goes less to the brain, and therefore the level of alertness, consciousness of the individual suffers and the patient falls on the ground. This is what is called as heat syncope. ये आप लोगों ने अक्सर देखा होगा एल्डरली लोगों में, जो कहीं पे किसी जलसे में कहीं पे टिकट्स लेने के लिए या बसों की कतार में खड़े होते हुए बहुत देर तक बिजी ह्यूमिड कंजेस्टेड एरियाज में खड़े होते हैं, सडनली उनमें से कोई गिर जाता है और वो 2-4 मिनट में उसके ऊपर थोड़े से छींटे मारे जाते हैं वगैरह वगैरह, और वो पेशेंट खड़ा हो जाता है. सो दिस इज व्हाट इज कॉल्ड हीट सिंकोप. तो ये 4 स्टेप्स उसी को मैंने रिवर्स फॉर्म में बताया है. सो द लोएस्ट इज heat cramps where there is more of sweating and the salts from the body are lost. Salt basically means जिसे आप अपनी लैंग्वेज में सबसे पहले नमक बताएंगे. So इसमें हमारे को अपने आप को थोड़ा सा रेस्ट देना है, थोड़ा सा स्पोर्ट्स को प्रॉपरली प्ले करना है, बिकॉज इतनी हीट में, जैसे आजकल हीट आ रही है, इस हीट में इस समय स्पोर्ट्स पे जाना बड़ा खतरनाक हो सकता है और कुछ लिक्विड्स लेना हो जाता है. तो मैं आपसे बोलूंगा कि आप सभी लोग इस समय अवेलेबल हैं इस वेबिनार के लिए, लास्ट वाली लोएस्ट वाली इन पिक्चर्स को दिमाग में बिठा लीजिए, which means heat cramps are the lowest level of dysfunction in the body, normally starting from our calf muscles, and basically because of low body salts, and causing the simple management is rest, taking sports in a proper way, and drinking more of liquids. Now इसका मैं ये मतलब निकालना चाह रहा हूँ कि हम लोग जो इससे नेक्स्ट हायर स्टेप है, विच इज हीट सिंकोप, हीट एग्जॉशन, हीट स्ट्रोक, उसकी तरफ हम क्यों सोच रहे हैं. हमें इन चीजों के बारे में सोचने की, इन तीनों चीजों के ऊपर जाने की जरूरत ही नहीं पड़ेगी अगर हम बेसिकली इस ग्राउंड स्टेप को लेके रखेंगे. तो इन 3 स्टेप्स में जाने का हमारा मौका परसेंटेज कम होता चला जाएगा. सो अगेन रिक्वेस्टिंग ऑल ऑफ यू टू प्लीज टेक दिस लास्ट स्टेप as a mental picture, don't forget it. Syncope is, again, as I have said, there is less blood, the person falls. In heat cramps, the person does not fall. Heat syncope, the person falls. And here there is a medical referral which is required. Even legs. देखिए अभी मैंने आपसे बोला था कि ये इंसान जो कभी भीड़ भड़के में किसी बिजी एरिया में खड़े हुए गिर जाते हैं, वो 2-4 मिनट में अपने आप खड़े हो जाते हैं, बिकॉज जब आप वर्टिकल हैं तो आपके ऊपर ग्रेविटी का असर आ रहा है, तो आपके पैरों में मैक्सिमम ब्लड हो जाएगा, ब्रेन में मिनिमम ब्लड जाएगा. सो ब्रेन में ब्लड नहीं जाएगा तो आप बेहोश हो जाएंगे और गिर जाएंगे. देयरफॉर अगर वो पेशेंट गिर जाता है, वो इंसान फ्लैट हो जाता है, तो उसके हेड एंड पे और फुट एंड पे ग्रेविटी का असर बराबर आएगा. तो जो ब्लड पैरों में ज्यादा इकट्ठा हो रहा था, वो रीडिस्ट्रीब्यूट होके ब्रेन में भी ज्यादा जाना शुरू हो जाएगा. सो रिलेटिव मोर सर्कुलेशन रीचेस द ब्रेन. यू गेट माय पॉइंट? When the person falls down, the blood which has gone into the feet, it gets raised and it gets distributed in the brain on a better scale. So therefore, in 2 to 3 minutes, this patient regains consciousness. और इसी को दूसरा करने का तरीका होता है कि जैसे पेशेंट के फुट एंड से और हेड एंड से इनमें ग्रेविटी का असर खत्म कर दिया और फुट एंड को हम अगर और ऊंचा उठा दें, सो रेज द फुट एंड ऑफ द इंडिविजुअल, तो लेग्स में जो ब्लड है वो नीचे की तरफ भागेगा और वो ब्रेन में और हार्ट में ज्यादा सर्कुलेट करेगा. सो मोर ब्लड सप्लाई टू द ब्रेन एंड पेशेंट रीगेन्स कॉन्शियसनेस इमीडिएटली. A very very common thing which you experience anywhere, and so all of us as a human person should know that इस इंसान की टांगे ऊपर कर दी जाए तो उसको मदद मिल जाएगी. अगर इसी फॉर्म में अगर डिहाइड्रेशन बढ़ती चली जाती है तो उस स्टेज पे हीट एग्जॉशन हो जाती है. जैसे आप कोई यू आर डूइंग वर्क एट द पेरिफेरी एंड यू आर मूविंग आउट and maybe you take a glass of water here and there, but or maybe a coke, but that doesn't serve the purpose, and therefore you fall into much major exhaustion. Here we have to remove the clothes as much as possible, reduce the temperature of the individual as much as we can by soaking him in cold water. And beyond that, of course, if the temperature goes beyond 104 degrees, then it leads to what is called as hot heat stroke, which over the phase of time is most dangerous because it can cause failure of various organs in the body. Now understand, we are going into the most complicated phase of heat stroke, so why not take care at the very best ground level? हाँ, ऊपर क्यों जा रहे हैं हम लोग? ऊपर इसीलिए जा रहे हैं क्योंकि इन सारे स्टेप्स को हम लोगों ने अवॉइड किया है. So think of the simplest step and that will help us. So heat exhaustion, the stage 3 as I have showed you, and heat stroke as I have showed you as the stage 4. इसमें heat exhaustion में you feel faint and dizziness, you have excessive sweating. यहाँ पे sweating fail हो चुकी है. This is why it is called a stroke. It is involved the brain. There is throbbing headache. The sweating has already stopped. Sweating, please remember, sweating is a mechanism to reduce our body temperature. जैसे आपके घर में बहुत गर्मी हो जाती है, कुछ कहीं धुआं हो जाता है आग की वजह से, तो आप विंडोज और डोर्स उसके खोल देते हैं ताकि वो सारी गंदगी, वो सारी हीट, वो सारा ह्यूम्स, वो सारे बाहर निकल जाए. सो दैट इज बेसिकली अ प्रोटेक्टिव मैकेनिज्म. अदरवाइज बहुत लोगों को हाई लेवल ऑफ स्मोक की वजह से प्रॉब्लम आनी शुरू हो जाएगी. सो देयरफॉर we try to help the patient, but here the sweating itself has stopped. So आप उस घर के दरवाजे खिड़कियां बंद नहीं कर पा रहे हैं. So जो इंसान उसके अंदर है, they are going to face more problem. The body temperature has increased. It goes beyond 103 and 104 और चमड़ी बिल्कुल एकदम से लाल गर्म हो जाती है. मतलब उस पेशेंट की चमड़ी को हाथ लगाने में कष्ट होना शुरू हो जाता होता है. This is what you practically experience. और यहाँ पे जो हीट एग्जॉस्शन है, दिस इज क्लैमी स्किन. क्लैमी स्किन इज वेयर हाइड्रेशन इज टोटली लॉस्ट एंड दिस इज asking for nausea and vomiting, and this can also ask for nausea and vomiting. So you understand the basic difference in heat stroke and heat exhaustion is this person has got severe headache, no sweating, he has got excessive sweating, and he is into a fainting spell. So as I have told, they are stage 3, stage 4. It is the same spectrum which has shown, and both of them are preventable conditions affecting diversely different patients. Recent research has identified a cascade of inflammatory pathological events that begin with mild heat exhaustion, or if uninterrupted, can lead to multi-organ failure and death. Heat exhaustion is characterized by non-specific symptoms such as malaise, headache, nausea, while untreated heat exhaustion can lead to heat stroke, a much more serious condition involving central nervous system, which may cause delirium, coma, restlessness, and of course, no sweating. So this comes to nearly the same findings in a different way. So heat stroke, as it is the most severe form, I will like that few of you are a little more aligned to remembering the complaints that these patients or the symptoms that these patients might show. Altered mental status, sweating alteration, nausea, vomiting, flushed skin, rapid breathing, fast heart rate, headache, seizures, unconsciousness. So look at these two things. The previous pictures were talking about headache. Seizures is जिसको आप मिर्गी का दौरा बोलते हैं. सीजर पड़ने शुरू हो सकते हैं, अनकॉन्शियसनेस होनी इस पेशेंट में शुरू हो सकती है. Therefore, this is said to be a very severe form of condition. All these are because of extreme heat and high humidity and vigorous physical exertion under the sun. So that's what we say. This is not the time to go for physical exertion. And if you want to go for it, it should be very early mornings of the day when the sun has not gone up. These problems are going to increase as the rainy season sets in, where the humidity of the air will be much higher. Dehydrated system, again, it is not able to sweat fast enough to dissipate. Therefore, the first thing that all of you should remember is Nimbu Pani with salt and lemon and water. This is the drink of the day and the season. We are more comfortable in having tea, coffee, not against it, but consuming these things, namak wala pani with a little of lemon, that is a much, much, much better option for any individual. You add sugar to it or not is your choice, but most of the times we don't ask for sugar because that the body will take care of. And who are the people at risk? First, we are all at risk because this is an extreme temperature, but then the elderly who have got some kind of heart disease, who have got some kind of lung disease, kidney disease, who are taking medications are more vulnerable. Athletes, individuals who work outside and physically exert themselves under the sun. Now, please see that a lot of elderly patients in the society, diabetic, hypertensive, cardiac issues, they are being given some kind of drugs which lead to extra urine formation and expulsion from the body. Some drugs to cause extra water propulsion from the body. These products are called diuretics. These are given in all those patients who have high blood pressure, maybe diabetes, maybe lung failure, maybe heart failure, and all those associated things. Please remember that, therefore, we always tell the people that elderlies with all these problems must see the doctor when the season is changing. Because before summers, if you come to us, we are likely to reduce that group of substances. Or even if you are sweating a lot, you are losing more of salt, your body salt will go less, your body pressure will go less. Again, therefore, a re-recommendation and readjustment in the dose of cardiac and hypertensive medications, especially diuretics, is an essential requirement. And when you talk about winters, the whole process is reversed. So if the patient elderly at home is all comfortable, even in that case, before the start of summers and before the start of severe winters, the drugs need to be reassessed. So in all these cases, the first thing is we have to try to keep the patient, make the patient as cold as possible. We put the patient in a shady area. We try to remove the clothes, apply cold and tepid water to the skin, or we can maro thande pani ka cheeta, as may be possible at some of these places. Fan the victim to promote sweating and evaporation, and place ice packs under the armpits and groins, because these armpits and groin areas are loaded with huge amount of blood vessels. तो उस एरिया में ब्लड फ्लो बहुत ज्यादा हो रहा होता है. तो अगर उस एरिया में हम थोड़े से आइस पैक्स रखेंगे, तो ब्लड कमिंग इन कॉन्टैक्ट विद दैट जोन will try to reduce the internal temperature of the circulating blood and therefore improving the patient. If the patient is able to drink liquids, have them drink cold water or other cold beverage that do not contain alcohol or caffeine. Please see to this. In some cases, this is more for theoretical reasons, that we have non-exertional heat stroke and exertional heat stroke. The very simple word tells you the difference between the two. We know that we have 911, which can be called from many of the hospitals, or 100 in some areas in India. While there are paramedics waiting, there are some institutions, including part of our max hospitals, where the helpers are on mobiles to reach the area much faster, taking into account the kind of traffic we have. And we try to keep a check on the temperature of the patient and keep doing all measures to reduce it. When we have entered into the stage of heat stroke, it's a medical emergency, and this is one of the leading causes of preventable deaths in sports. So rapid reduction of core body temperature is the cornerstone of treatment, because the duration of hypothermia is the प्राइमरी डिटर्मिनेंट, जिसके बोलते हैं, देखिए आप किसी कोई वेजिटेबल लेते हैं, उसको एक्स्ट्रा हीट अगर कर देते हैं तो वो चार हो जाती है, जिसको काला बोला जा सकता है, जिसको सड़ जाती है बोल सकते हैं हम लोग. उसी तरीके से इफ द बॉडी टेम्परेचर गोज बियॉन्ड ए सर्टेन रेंज, the enzymes in the brain get charged. If the enzymes are charged, the brain will not be able to function. So that is why the stroke must be recovered at the earliest. If there is damage to the these electric to the chemical mediators in the brain, part of the brain cells will die. Part of the brain cells will die, which cannot be recovered. Which cannot be recovered. So therefore, reducing the temperature and therefore allowing the enzymes in the brain to continue with their functions is the primary role that we have to play for it. Because if these cells are damaged, it will lead to irreversible deficiencies in the mental capabilities in whatever form. So, rest, it of course is more of a repetition in various forms. Please remember that when we talk of the heat, it is that a lot of other things are also coming into the atmosphere from medical point of view, which means the hygiene of all the components is for a cross. People who are vendors, who are using their hands, who cannot take care of the sweat, the things get merged with the food particles which they are serving. The contamination of sewage and drinking water starts happening when the rainy season starts. Another time when again the infective loads are increased. So we have already started facing more problems in the hospitals in the form of more of gastroenteritis, in the form of more of jaundice, in the form of more of typhoids. And a little later, as the rainy seasons come in, we will start having more cases of flu. So it is advised that apart from taking care of very simple basic facts like avoiding the heat and trying to reduce the body temperature, it is suggested that all of us are thoroughly vaccinated against typhoid, hepatitis, and flu shots. These are basic cares which we are advising to all of you. Again, taking into account the people who are at extremes of ages, elderlies who are undergoing some kind of disease processes, who are under some kind of medications, all those are more prone to need all these things. So this is primarily repetition of whatever we have said. Now, I have given you a basic idea. I'm sure you have some doubts in your mind. So let's come on to the questions from your side, and that probably will bring me to what are the basic needs that your group has, and accordingly I'll try to guide you and appraise.
चेक बॉक्स में चेक
नहीं, नहीं, there's one chat. So there is one question by Mr. Yadav who says, you feel pain in the body, especially in the legs and the hip area. Now, I don't know whether you are trying to relate it with the heat or in general you are feeling it. If you are trying to relate it to the heat season, then there are only two things which you have to look into. Take a lot of lemon, take a lot of salt. Two things. So this is what I said, Nimbu Pani or Lassi or Chach or Aam Panna, whatever you are comfortable with. If you are talking in terms of not the heat related, but even otherwise pains in these areas, then probably you need to see the doctor, because the other cause is simplest. I'm not talking about difficult diagnosis. I'll talk about the simplest, which means the deficiencies in vitamin B12, vitamin D. They are the commonest causes of having pains in these areas. And in case you go for a good clinical examination, even that can give us the diagnosis and we can modify the treatment for that. How to have children deal with extreme heat? What accessories can we use to deal with extreme weather when going out? So when you are, this is by somebody by the name of Mr. Rajanandan. See, first of all, is it important to go in the heat, extreme heat? One. Two, if you don't have a vehicle which is air conditioned, use umbrella. Three, before you move out, hydrate yourself well. Four, when you move out, carry excessive and a good amount of water and liquid based thing. Five, wear very light clothes, cotton clothes, light colors which repel more of clothes, and don't layer yourself. These are the basic cares which kids can be given. Hat can be used wherever it is possible. The next question is how to stay cool despite the heat and how to keep pets cool. Ma'am, the answer is what I have already said. We are all going through the same phase in hospitals, in larger places. Even air conditions are giving way because like in my room, I was not very comfortable. Called the engineer guy. He says we are working at 97%. The ACs which are available in the market, they are not to work at 50 and 52 degree. So they are also getting exhausted. Therefore, you feel more news of ACs and electrical fires at different places. So the answer is the same. Coming to the pets, it is again the same answer. Keep them inside, keep them in cool places, and if they have to go for their regular daily rounds, it should be very early hours or it should be late hours. So these are three questions which I have read, which I have tried to answer. It is a repetition of the question. Protection from heat stroke, I have already quoted all of these. After taking Covishield vaccine, is there any side effect? Very interesting question, very difficult question, and nobody has a good answer to that. Because I'll go to a step before this. What was COVID? What was Covishield? Etc. etc. So your doubts are same as are mine. That point of time, we were running after people to give them vaccines. This point of time, even if you want to go for a testing, it is not available. The mandate by the government has changed, and those mandates are being passed on to the hospital, and therefore we are, conveying the same to the public, which we come in connect with. So, as far as Covishield and heat wave is concerned, I don't have any published medical data, so I will not be able to comment beyond it. Ma'am, it is again the same question, the question of heat stroke. We have given it is the extreme heat which is affecting us at stage 1, stage 2, stage 3. We do not take care, we'll end up into stage 4, which is heat stroke, coupled with some basic background situations, which means extremes of ages, diabetic, hypertension, renal disease, and cardiac diseases. So as I said, remember the first or the basic paragraph, the diagram, the lowest of it. Start working as soon as possible. Start preventing as soon as possible. So my job is lightly dressed, easily dressed, avoid outdoor activities, hydrate myself well. First aid box for heat stroke. A good amount of coolants, lot of liquids, maybe oral rehydration solutions, ORS electrols. These compounds are much better in taste these days. So 1 liter of water, and we can mix it into that. That will give us all essential, electrolytes. And I have tried this many a times. If I'm going on a trek kind of a thing, I will take 1 liter of water, add a bit of these, one pack of it, and this gives good protection, including the deficiency in electrolytes and potassium and salt, which can happen over the phase of time and therefore cause pains in the legs by evening. And then, of course, making arrangement for some ice packs, some good towels, some bags in which ice can be applied to the patient, a thermometer, something to prevent anti-vomiting, vomiting and acidity, as we call it. Those basic cares in the form of at least Pantocid and Domstal should be available with all the kits that we have in all corporate centers. Yes, diabetic and cardiac patients are certainly more at risk. I have already said, including the drugs which they may be getting. So that's the reason for it. Maybe 6-7 questions, all of them have been answered.
Poonam, can we close it?
Yes, ma'am. There's no more query now.
Thank you very much.
Thank
If you still have some queries which come up later, please send a mail to us and we'll give you the perfect answer.
Sure,
Okay.
sir. Thank you so much for your time, sir. Thank you so
Thank
much.
you.
Thank you, ma'am.